On this edition of Legally Speaking, a special unit dedicated to preventing Medicaid fraud and patient abuse. Hello, I'm Richard Pyatt. The Utah Attorney General's office has an office that, working with federal agents, is dedicated to protecting the integrity of our Medicaid system. In other words, we work to take on fraud, waste, or abuse of our program. It's called the Medicaid Fraud Control Unit, or MFCU. It's important to point out that every state has a MFCU, but Utah received the Inspector General's Award for Excellence in 2023, which is a huge feather in the cap of everyone who works in our office, and to our guest, Kaye Lynn Wooten, its director. Thanks for joining me, Kaye Lynn.
Thank you for having me.
MFCU sounds like a cute name, but the mission, of course, is extremely serious. Tell us a little bit more about what you do there.
Absolutely. Medicaid is an important program for people who need the services. And if that money is wasted or people commit fraud against the program, that money is simply not available to meet the needs of the people in our state. So our job is to work with state and federal partners to find people who take advantage of the Medicaid program and prevent the funds from being spent the way they should be.
And this could be in a variety of ways. This could be somebody submitting false claims. This could be somebody filing claims on behalf of a loved one that doesn't realize the loved one doesn't realize, their Medicaid legitimate recipient doesn't realize what's happening. All kinds of different dynamics can go on there.
Absolutely. It can be billing for a service that a patient received, but maybe upcoding that and charging for a greater service than was actually provided, or for billing for patients who didn't come in and receive services at all. The range is wide, and we work a lot with state and national partners to figure out what the fraud trends are that we need to protect the Medicaid program from.
So I understand there's a recent change to a name change to your division. Can you explain how you've made this a little bit perhaps more accurate about what it is that the unit does?
Absolutely. Our division was created in 1980, and since that time, we've had not only the mission to combat Medicaid fraud, but also to protect vulnerable individuals from abuse, neglect, and exploitation. And even though we've done that now for about 40 years, people were confused because the name said Medicaid fraud, and that's all they knew that we were devoted to. So we've recently locally gone by the Medicaid Fraud and Patient Abuse Division so that partners like Adult Protective Services, Ombudsman, and providers know that they can refer cases to us to protect people.
So an example of that perhaps would be there were some recent cases that were in the news where Medicaid federal money was used to fund a care center. That care center was in trouble, a variety of reasons for the reason that the center was in trouble, perhaps not properly taking care of patients. But that falls under your jurisdiction because the abuse or the improper handling of that patient using that federal money falls into our jurisdiction. So that's kind of a little niche that a lot of people don't really think about. They think that it's outright scammers that are happening, but it's improper or maybe even incompetence that's happening.
That's right. If you can imagine maybe residents in a facility not receiving the care they're supposed to, the state, thinking that they are receiving that care, pays large amounts. And so when we look at a case, it might be that we find it's fraudulent billing, or we might just find overall there's a pattern of neglect, and those residents deserve better care. We also can look, though, at abuse, neglect, and exploitation committed by family members or people in the community who take advantage of people who are in facilities. Maybe they steal their money. Maybe they change their wills. Maybe they fraudulently do something that abuses, neglects, or exploits a vulnerable individual. And we can also take those cases and have had a lot lately.
So is there a lot of systemic abuse going on? It's sort of disturbing to think about people trying to rip off the system, and even more disturbing to think about someone ripping off the system in the name of someone that's maybe somebody that they care about or that is a loved one. Is there a lot of that kind of thing going on? Is it enough to keep you busy beyond what our resources have?
We are more than busy. In fact, recently we asked the legislature for an office in the St. George area because our staff is traveling and needs more resources, and we're hoping to be able to obtain that next year. But if you look at the complaints that come into Adult Protective Services, the number one complaint is financial exploitation. And unfortunately, we are seeing a lot of that, where family members put their mother or father, grandmother, grandfather into a facility and then take all the money that has been saved for retirement. And that does two things. It's painful for the resident who later learns what the family member has done, but then that resident eventually ends up on Medicaid because they no longer have their own funds to pay for their care. So it affects the state. So these complex cases have a value both for the state and for the victim when we resolve them.
So we protect both victims, but we're also protecting taxpayers because there's a lot of money that goes into these programs. How challenging, how tough are the cases that we usually face?
A lot of our investigators have had 20 or 30 years of experience. And when they come to Medicaid fraud, they think, oh, I've already investigated so many financial crimes or person crimes. And they're amazed at the complexity involved when you have victims, for instance, who may not be able to testify or who have already passed away, or complex billing schemes that require us to use subpoenas and search warrants to obtain medical records and claims data and figure out who should be held responsible for crimes. And we're really dedicated to that. We find a bad outcome, but spend a lot of time trying to figure out, was it truly just the aide who provided care in the facility, or is it a systemic problem that needs to be handled with a broader group of people?
So would you say that the goal of the unit is to ensure compliance, or to guide a facility and its employees to comply, or are because a lot of people, when they find out that this kind of abuse is happening, they want to be very punitive and they want that person to face a heavy prison sentence. We had a case that we were dealing with a while ago where there was a question about how severe the penalty was. We have to work within the guidelines of the law, but does it really serve to have someone spend a lot of time in prison when really what we want to do is to stop the behavior, to correct it, and to, if possible, recover the money that has been lost?
Right. We have to draw a careful line between what, say, the Department of Health and Human Services does versus the Medicaid Fraud and Patient Abuse Division. There are a lot of programs in the state who can teach providers what to do appropriately, and will follow up and monitor whether they're doing that. By the time a case comes to us, there's been a bad outcome, and we are responsible for finding out what the result should be. And in some cases, you're right. It doesn't take a lot of jail time to stop the problem, protect the victim, protect the Medicaid program, and move on. But we've had some cases over this past year where prison time was the appropriate outcome. We have an eye surgeon who's in prison right now and a family member who's in prison. And it's not difficult. I mean, it is difficult to decide the right outcome, but those were very appropriate given the horror that we saw.
Is there any hope of recovering the lost money in either of those cases that you mentioned?
In the first case, the physician, I think there will be some benefit to the victims, and we've been working closely with Victim Advocate Services and others to try to make that happen, the Utah Victim Office of Crime, and everyone's working together. On the case involving a family member with exploitation, I won't go into too much detail, but the first case with this same perpetrator resulted in him taking a house from a mother. And we were able to file a lis pendens, preserve those processes, and when the house finally sold, get back a fair amount for the victim. In that case, the defendant would not have gone to prison. But while we were going through the sentencing phase and wrapping up the first case, the defendant again came in and exploited his mother again, taking her investments and her cash. And the judge just felt that there was no good outcome there. There was not a lot of money left, and prison was appropriate.
Okay. It's interesting to point that out. How does our unit interface with other states and with the federal government? Because we're all kind of tied together in many situations, I bet.
Yeah, great question. We work closely through the National Association. It's called the National Association of Medicaid Fraud Control Units. All 50 states have MFCUs, as well as 3 territories, and we get training with each other there. 2 of our staff serve as facilitators for that association and teach classes. We work closely with them so we don't have to reinvent the wheel every time we have a case. That association is so supportive and helps us even create appropriate policies and practices. The federal partners and state partners are, I think, one of the things we're most proud of. And when we got the Mafuku of the Year award, it was to recognize how well we have worked with all these partners. So for instance, we have one of our agents works part-time with the DEA and is embedded in their office, only working on cases that fall within our jurisdiction. That allows us to use federal tools. It allows us to collaborate better. We work with the FBI, Health and Human Services, Office of Inspector General. And what we find is most fraudsters don't just defraud one program. So if Medicaid fraud's going on, there's probably Medicare, private insurance, private pay. And by working together, we're able to build the true case and get an accurate result rather than just focusing on Medicaid.
Now, in 2023, our office won the Excellence Award from the Inspector General. That's a pretty significant award. Hats off to you and the people that you work with. How would you explain the significance of that? Kind of give us some context of what we're standing out. Utah as a fairly small state against Mafukus in larger states like California. There's got to be a ton of fraud going on in states like that. Resources there are 20 times what we have.
Absolutely. And I think why it was so rewarding to receive that award was that they recognized the hard work we were doing with the resources we had for a state our size. And they especially commented on our ability to partner with other agencies. And by doing that, we're able to accomplish more than our tiny unit could. We have 19 employees, and that makes us similar to states like Arkansas. Financially, we're similar to Colorado as far as our expenditures. And we compare closely to make sure that we're working hard to get the results that we should for our state our size. But I think another reason we were recognized is during COVID, some states struggled to keep moving or shut down. And from the AG, from our own Attorney General on down, we were encouraged to be productive and keep things moving. And we were able to do that. And I think that's what led to a small state being recognized. We had indictments, we had convictions, we had civil recoveries that were really very similar to the year prior to COVID. And I think that support and that strength and that commitment is what got the award.
So you alluded to this earlier with your when you addressed the request of the legislature, but how has our Mafuku changed over the last few years? I imagine that as the state's population has grown, Mafuku is growing too. And you mentioned St. George. There's a lot of Medicaid and Medicare recipients down there. There might be a lot of fraud going on there. Am I on the right track?
Absolutely.
And sort of like drawing these conclusions?
St. George and Cedar City are growing so rapidly, and we're trying very hard to meet the need. But if you can imagine, every trip we make down there is an 8-hour round trip. And those are hours that could be spent investigating, prosecuting, educating providers. And so we're doing the work and trying to cover the area. But the more that adult protective services and providers and other entities find out about us, they just know that we're stretched thin. And we don't want to have to limit the number of cases we can take, but we also don't want to shortchange the cases we do take. And so we're really hoping that we can get a presence down in St. George, minimize the expense and the time traveling, and really focus on the needs in those communities.
So there might be some people who are listening that have a tip or that may want to contact the office. We'll put that information on our website in the link on our blog site to how to get in touch with the office, and then perhaps we can expand my workload even more. How would that be?
Because we'd be protecting people, we're always anxious to grow with the cases that need our work.
I know. I've met your staff. You guys are awesome over there. So thanks for what you do, and thank you for joining me today.
Thank you for having me.
And for our audience, we will talk to you next time here on Legally Speaking.